Huh? Yeah. Cool. I'm going to share my slide presentation. We're going to go over some of the muscles that you went over in your homework. Might add a few comments about them, things like that. Then tonight you'll have a test on them, open book, just nothing's changing. Nothing's changing. And then you also have a answer the questions in the back of a chapter for, I think it's chapter 20, muscular system, which is the next system we're going to look at. We look at a lot of systems the first two classes, and then it kind of becomes all muscles towards the end. Anyway, let's do this. If you have any questions, feel free to speak up. Please, please, please. For one thing, you guys ask really good questions. All right. So, shoulders and arms. We're kind of traveling down the arm here. If you think about it, we started out on the axial skeletal system and we looked at what attached the scapula to the axial skeletal system. The scapula is part of the appendicular skeletal system. It's part of your appendages. And we looked at what attached it to the axial skeletal system. And Miss McDowell was kind enough today to tell us that in back, it's the trapezius with the levator scapula and the rhomboids, and in front, it's serratus anterior and pec minor. Those things glue the scapula on to the body. And then we all went on to study as a class what glues the scapula onto your body, what glues this arm onto the scapula, and we discussed the four rotator cuff muscles, which were the, Ms. Munoz, I believe, very kindly told us, was the supraspinatus, infraspinatus, teres minor, and subscapularis. And then we also discussed, I believe it was Mr. Placencia actually, who discussed that the deltoid shares an insertion with trapezius, and the deltoid too helps to hold this arm on and do that. We're now going to move down the arm and down across the chest and look at some other muscles. Okay, so let's do that as we move out further. Oh boy. Okay, so we talked about the pectoralis minor. Remember this? Pectoralis minor. Do not forget it. Attaches to ribs 3, 4, and 5. 3, 4, and 5. 3. Boom. Attaches to the coracoid process of the scapula. It's actually here in front. It's actually attached to that and kind of pulls my scapula forward and down. The pectoralis minor moves the scapula. The pectoralis major is just called the major because it's on top of the minor. It's a very different muscle. Pectoralis major, if you want to make a sign for that, you'd be better off taking your entire hand like this because that's about the size. It really is about the size. And the pectoralis major attaches to the humerus. It attaches to the humerus and it therefore moves the glenohumeral joint. So yes, sometimes it works with the pec minor, but it's very, very different. Pec minor pulls the scapula forward and down. The pec major moves the arm around. Yes. And you guys, for the most part, listed correct actions of the major. I don't know if you all knew what you were writing, but you did list correct actions, which were to medially rotate and adduct, which means to pull my arms back down to my body, and horizontally adduct, and flex and extend. I guess I can see how that would happen. I didn't even think about that. Sorry, I was looking at my slide here. So let's talk about how we get all these crazy actions from one muscle, because it's kind of like the trapezius. Remember the trapezius had upper and middle and lower fibers, and they ran different directions, so they might as well be three different muscles. Pecs are kind of like that, but they have a very interesting thing that the pecs do. And so I'm going to show you that on my own body. I will kind of be your pec model. So, let's get rid of this. Voila. Okay. Here's what's interesting. The pecs like to have an origin of the medial half of the clavicle, the sternum of the first 6 ribs. So it likes to attach in here. But what's very interesting about it is how it inserts. It inserts into the crest, I hope, of the greater tubercle. Yeah, the greater tubercle. So that is way over here on the side of your arm, and it's the crest that comes off that. There's a crest that kind of runs down from this mountain. It's called the greater tubercle, the crest of the greater tubercle. But here's what's interesting. Here's what's interesting. The upper fibers attach low, and the lower fibers attach high. So, again, I'm oversimplifying for your edification. Well, I need a different color. It'll show up well on black. But it'll make a lot of things clear to you. And the lower fibers actually attach up. So, in no way do I think the attachment is this big. But I want to make a very clear point that these fibers from the lower pec actually attach up high on the arm. The fibers that are high in the upper pec actually attach low. They cross over. If you look at the picture on the slide, it's much more close, but they cross over each other, and this is very important. So, yes, very important. Good. So, what do you suppose this red tape would do if it started to shorten? What do you suppose this red tape would do if it started to shorten? Miss Estes, what do you suppose it might do?
Well, it's going to get smaller, right? It's
Yes,
going to contract.
it will. If it contracts, so what movement am I going to get out of my arm, out of my femoral joint?
Okay, yeah. Well, that's going to be a medial rotation, or
I like that. By the way, she's 100% right, by the way, everybody. Both of these would create medial rotations. They would roll my arm in because they're in front, and just like grabbing my sleeve, they would roll me in. Medial rotation, yes. What is this upper fiber that grabs down low specifically going to do? Any guess? Don't worry, we're just exploring this.
Adduct? Or
it can. So if my arm is way out here to the side, it can help pull that in. Sure. Sure. Can you also see it maybe kind of grabbing my arm from here and
flex it up?
Yes, that was correct actually. That was really good.
Okay.
It creates some flexion of the glenohumeral joint. Now, Miss Estes, just since I got you on the hook, can you see what the lower fibers might actually do if they pull?
Yeah, that's going to extend.
Yeah, and that's weird. It's weird to have a muscle do two different things. But she's absolutely right, by the way. Flexions happen as I move towards the front of my body. Extensions happen as I move back. I'm already starting to extend right now. This is an extension the minute I start moving back. And so these lower fibers can actually help to extend, pull down my arm. And the upper fibers can actually help to flex it. Yeah, good job, Miss Estes. Thank you. Yes, Miss Walker T.
So when we're talking about extension with the lower fibers, right?
Extension of the lower fibers, yes.
We're not talking so much extension behind or to the back. We're more talking like when it's in a flexion, just that movement kind of bringing it back to the middle of the body.
Yeah. So remember, you're 100% correct, ma'am. 100% correct. But extension and flexion doesn't actually work that way. It just talks about where you're headed. And so you're absolutely right. I am now extending, but she's right. It's going to lose power here. If it keeps pulling here, it's not going to keep taking me back. It's got to be behind me for that. So you're absolutely right. It actually only helps with extensions when I'm fully flexed, basically, right? But it's still considered an extension. Yeah.
Okay, got it. Because I was a little confused on that one because I was like, there's no way that helps you.
Right. We asked this to make these same kind of points. Like if I asked you, what am I doing right now, Miss Walker?
Are you talking to me still?
Yes.
And you're saying, what are you doing right now? You're holding your shoulder in a flexed position?
Yeah, and that's not even the answer. I'm just sticking my arm out. They would actually not call this a flexion or extension. There's no action occurring. So flexions and extensions and adductions and abductions and all that stuff has to have movement. So right now I am not flexing, I'm not extending. We understand that muscles are contracting to hold me here. But what we're saying is there is not an action here. Now an action is occurring, now an action is occurring, now an action is occurring, now an action is occurring. So yeah, so when this thing pulls down like this and it pulls my arm down, that's an extension. It's heading towards the back, even though we know it'll never get there. You're absolutely right. Crazy concept, but very well done. So anyway, guys, it's this crisscross that allows you to get a flexion and an extension in some cases. And can we see the adduction? The adduction means when my arm is out to the side, when these pull, they're going to just pull my arm back in. They will also do, both sets will do a horizontal adduction. Horizontal adduction is when my arms are out to the side and it pulls me in. This is why your pec major is your major bench press muscle. Because really when I'm bench pressing, what is my glenohumeral joint doing? What is the action of my glenohumeral joint doing when I bench press? Anybody? What's my shoulder joint doing when I bench press? What action is that?
Rotation.
What about who? What?
Medial rotation.
No, medial rotation would literally just be me turning in like that. What is my glenohumeral joint doing?
Is the adduction
What kind of adduction?
horizontal?
She's right. My glenohumeral joint is just doing this. It's horizontally adducting. You guys get a little confused because you see my elbow doing something different, and it is. So my pec, when I'm doing bench press, helps me to horizontally adduct and do the bench press, right? The second thing that happens, by the way, is my tricep helps me to extend. Bench is a tricep and pec workout. Cool. So that's your pectoralis major. Pectoralis major. So to stretch this muscle, we do the opposite of its actions. So we abduct it. For one thing, horizontally abducting this muscle is a great way to stretch it. Yeah? What do we do to this muscle to make it loose so I can get to the pec minor underneath? Because to be honest with you, I'm usually more worried about pec minor. Pec major is important, but I usually actually am having more problems with pec minor than pec major because pec minor affects scapula movement, the brachial plexus coming through here, all that kind of stuff. So how do I get the pec major to be loose? What position do I put the arm in to make it loose so I can get through it and get into the pec minor? Anybody? Yes? Yeah, Mr. Riedel.
You horizontally abduct it.
Horizontally adduct it? Is that what you said? AD?
AD.
Yeah.
Oh wait, no, AB. It's AB.
Well, AB stretches it. So
Oh,
it
okay,
actually makes it tighter. Yeah.
Yeah, I said it backwards. It was the
Adduct?
AD.
Yeah, AD.
Yeah.
Now, by the way, if the client adducts it, that's not good. They're flexing. And I can make my chest really tight by doing that. But I'm talking about if I lift the client's arm over. Because look what happens to this tape. If we lift this arm over, this tape is just all loose. And that's exactly what we want. So we would horizontally adduct the arm, medially rotate the arm, all these things. If we do it as a massage therapist for the client, it leaves loose slack in their muscle. And I can get through the loose slack to get to the pectoralis minor. Now, you don't always want to do that, but that is why you want to study anatomy, because quite often we are using anatomy to help us get to another muscle. And I can't emphasize enough, if the client is horizontally adducting, that makes it tighter because they are contracting. But if they don't do it, if I just bring the arm over, the tape doesn't shorten, it stays long and it's all loose. Just bring the arm over and it should be loose and you'll get in there. Does that make sense at least? I hope. Good. Yes, Miss McDowell, please. Oh, raise your hand. Andy.
No, I was finishing chewing. So is that the same for like if you want to make every muscle loose, it has to be passive action, like they're not doing it, you're doing it for them?
Yeah, let me rephrase what Miss McDowell said because it's a universal truth. I don't know if it's written down anywhere, but it works all the time. There are no exceptions. So, 100% of the time, if a client does the action, the muscle gets tighter because that's how actions work. The muscle is contracting, it's getting tighter, it's shortening, and it pulls them into the action. 100% of the time, if the client does the action, the muscle gets shorter and it gets tighter. 100% of the time, if you or the client does the opposite of the action, you're stretching the muscle. 100% of the time, whatever the action is of any muscle, if you do the opposite, it stretches it. And where Ms. McDowell was getting to was 100% of the time, if I do the action for the client and they don't contract, we put them in a position where the muscle is loose and floppy. This is very easy to see with biceps. So if I contract my bicep and pull it up here, it's kind of hard. But if I just bring my arm up here with my other arm, you've got lots of floppy bicep here, right? Really attractive. But it's floppy because it's still long. It's still this length. It's still this length. I lifted the arm up. It's still long. So it's all this rope hanging around. And that's what we want to do. So yes, Ms. McDowell, if you perform an action for a client, it puts them in a situation where the muscle is soft and loose. And that can be very useful, especially if you're trying to get to a lower muscle. Yeah. Now there are times we want the muscle tight. Like if I'm really trying to open up somebody's pec major, I might put them in a stretch and work the pec major. Then I'm double stretching them really. Because massage is a stretch, it really is. So I've got them in a macro stretch here and I'm doing a micro stretch here and they're getting one heck of a massage. I don't do that to everybody because it's a very intense way to work. Massaging people in a stretch is highly, highly effective. It also hurts more. It just hurts more. You're more sensitive when you're in a stretch. So that's the other reason I'll bring this arm in if they're like too sensitive and I'm like, I'm hardly touching you. I'll bring this in and make this looser just because they can't take the stretch out there. Good. Cool, cool, cool. All right. Pectoralis major. What most people associate it with is horizontal adduction, bench press. But it can, as you see, can help with a flexion, can help with an extension, and medial rotation. Yeah. And it moves the glenohumeral joint. It goes across that joint. It's moving my humerus through the glenohumeral joint. It's not moving the scapula. Doesn't mean the pec minor doesn't work with it a lot. It does. But they do different things. They're working on a project together, not a movement together. Yes, Miss Lovitz. Miss Lovitz, the way you grabbed your forehead there said a lot. So, what, have I broken your brain? Are you okay?
So if you're doing bench press,
Yeah.
to horizontally adduct, you're using the upper fibers. If you're only doing that, then are you going to have weaker lower fibers? How would you work out that area?
Well, this is great because you have a personal trainer for a husband. So let's give you some ammo so you can bring it back to him and be like, it's my favorite thing to do. So, right? So you're absolutely right. By the way, there are certain movements that will work your upper fibers more and other movements that will work your lower fibers more. So if you'll notice, my upper fibers tend to create flexions, right? This is me going diagonal, but this is a flexion. That's my upper fibers doing flexions. So believe it or not, when I'm doing incline bench press, I do get the upper fibers quite a bit. When I'm doing flat, it's still upper fibers, but we're starting to move to lower. And when I'm pushing down, have you ever done decline bench press?
Maybe, I don't remember.
Decline bench press or dips. Dips, if you think about dips, I have my arm way up here and it's my lower fibers that would pull. Lower fibers that would pull my arm down. Because look, they're stretched out here. I'm actually going to pull on them. They're going to bring my arm down. So, I mean, in this case, it's kind of easy to remember. Your incline movements work your upper fibers more. Your decline movements work your lower fibers more. And flat bench should work all of them to some degree. Flat bench should work all of them to some degree.
Okay, thank you.
Thank you. Those are good questions. Really good questions. Okay. Let's go on. What did I say back there? Oh, well, that's true. Okay. Okay. Let's look at a couple more muscles. So that's pecs. By the way, I hope you know this won't be the last time we talk about these muscles. This is just our introduction, right? All that kind of stuff. I don't want you guys to ever feel like, oh my God, 4 muscles. And, you know, we're going to review them all and stuff. But that was pec major. Now let's talk about the biceps brachii. Biceps brachii is very interesting. Its main job is to flex your shoulder. I'm sorry, I lied. Its main job is to flex your elbow. Your humeral ulnar joint, between your ulna and your humerus, humeral ulnar joint, its main job is to flex your elbow, which is why people do curls in the gym. They are working their biceps, or they think they are. And they are. They're working some other stuff too, though. But what's interesting about the biceps is, and you guys all said this in your homework, I just hope you recognize what you said, the long head actually inserts into the supraglenoid tubercle and the short head inserts into the coracoid process, which means they cross over the glenohumeral joint. And anytime you cross over a joint, you affect that joint. This is another universal rule. Anytime you cross over a joint, you move that joint. You have the potential to. So biceps, yes, their main job is to flex the elbow, but they can actually create a flexion of the shoulder. It's not their main job, they're not great at it, but they cross over the shoulder in front, and therefore when they contract, they can create a flexion of the shoulder. Your body has lots of overlap like this presumably in case you injure yourself. But so this bicep here, let's give you an idea here. Let's see, where are we? Come on, buddy. This bicep here can go down like that, but it actually hooks to the coracoid process here. So let me give you watch this. If I do this right, this arm wants to flex. It should also want to bend, by the way. If I have the thing bent here, we can see it starting to create a flexion at the elbow, but we can also see it start to create a flexion at the arm. Do you see this? This is me shortening the bicep. So it can actually bend the elbow, flex the humeral ulnar joint, or flex the glenohumeral joint, because it crosses over the shoulder. The other thing to remember is the short head actually runs under the acromion process into this glenoid fossa. So these guys in the gym, it's always guys who are curling too much, they're actually putting a tremendous amount of strain on their shoulders up here. That's actually part of the problem with their curls, and you can create quite a bit of damage in here. But anyway, do we see that the biceps can definitely create a flexion at the elbow, but can also, because they go across the shoulder here, they can also get the whole arm to come up and flex the arm? Anybody? Nobody sees that. Somebody sees that. One person sees it? Yes. Miss Routson, you see it? Good. Miss Routson, so how come every time I activate my bicep, do I not do this? Flex both.
Now you're asking me to think critically.
Yes. Thank you. Thinking critically. Yes, I'm asking you to think critically. Not always, guys, I guess. Yeah.
That's a really good question. Is it
Yeah.
because other muscles are stabilizing it?
That's a really good answer. You are 100% correct. I could not have said it better myself. That's exactly what happens. So we are studying muscular actions, but the biceps never work by themselves. So my body, literally when I'm doing bicep curls, go in the gym, everybody, and try it next time. When you're doing curls, if you're doing them correctly, you are stabilizing your glenohumeral joint. You're using your rear deltoid to create an extension and pull your arm back so that the bicep does not pull it forward, and therefore the power of the bicep just goes into the curl. But feel the back of your shoulders when you're doing heavy curls. They will be locked down to keep my arm from coming up. Plus the weight of the weight helps with that too, but that's what they do. So you're absolutely right. Miss Routson has just stumbled across like kinesiology 102, which is, and I don't mean stumbled across, you brilliantly answered that, is that other muscles stop unwanted movements. your brain is constantly using other muscles to stop unwanted movements, right? The pec actually goes across diagonal here, but you don't always use it this way. That would look silly. So my brain actually kicks in other muscles to stop it from going diagonally so it can only flex, or stop it from flexing so it can only horizontally adduct. So we use other muscles to stop unwanted movements or to draw something in a different direction. So that the biceps really can flex my glenohumeral joint and flex my humeral ulnar joint, my shoulder and my elbow. But it doesn't have to. It can just do one or the other by stopping those unwanted movements. But just remember, it actually runs into the tendons. Actually, the tendons on the long head actually run into the glenohumeral joint basically and attach right above the glenoid cavity on the supraglenoid tubercle, right above on this little tiny spot here where there's already all this action going on. So, what muscle touches essentially the long head of the, let me rephrase this better. What muscle rubs up against the tendon from the long head of the bicep that attaches into this supraglenoid tubercle? What muscle rubs on this guy?
Is it the supraspinatus?
Yeah. That's a very good answer, Miss McDowell. Now when I go to Miss McDowell and I've got some clicking in my shoulder, she looks at my supraspinatus muscle for sure. She knows, by the way, maybe she's even really, she elevates my shoulder, which loosens my trapezius and makes it easier for her to push through that and get in to my supraspinatus. But she's not your average therapist. So she also knows that my bicep and my bicep tendon actually feeds into this spot, and that if I have a tight bicep, that could be part of the problem here. And so she's actually rubbing my arm here too and loosening all this up too. And I go, why are you doing that? I told you you had a shoulder problem. She goes, oh, Mr. Tapscott, I completely understand, but actually one of your bicipital tendons actually inserts inside the joint. A lot of people don't know that, but that's why I'm doing that. Oh, I'm probably going to rebook with you because you seem to know what you're talking about. I have no idea what she just said to me, but it sounds smart. And she's right. Good job. Okay, that's biceps brachii. Literally means what? What does bi mean? 2. Anybody here ride a bicycle? 2 wheels. Unicycle? 1 wheel. Tricycle? Don't judge me, 3 wheels. Right? Bi. What does ceps mean? C-E-P-S. It means heads. So really biceps means a 2-headed muscle. Biceps brachii means a 2-headed muscle in the brachial region on your arm. Biceps brachii. You do have a biceps femoris, remember? That's a 2-headed muscle on your femur, down on your thigh. We just grazed over it, but we will get to that. And it's called that because it is a 2-headed muscle, just like the bicep, but it's actually on the femur. And it's funny because to people that know their anatomy, we don't just go around saying biceps. The rest of the world does because it's the only bis they know. But we know about the biceps femoris, which is a major muscle. So we'll say biceps femoris or biceps brachii because there is a difference. You've got a 3-headed muscle on the back of your arm. What's that called?
Triceps.
Triceps, and it's technically triceps brachii. Now, Miss Estes doesn't have to worry about that because there is no other tricep on your body that I can think of. So tricep works, but it is triceps brachii. Good job. All right, I love this. Good stuff, people. Okay, let's keep it coming. Then we'll go back and wrap it all up. Love it, love it, love it. Biceps. Biceps are highly palpatable, by the way. Essentially the size of your arm, this is for you, this is for Miss Lovitz, because I know that she's working out with her husband right now because she wants like 20-inch guns. She wants, yeah. And anyway, for those 20-inch guns, she needs to put as much size in her arm as possible. There's basically only 3 muscles that make up your brachial region, that arm. There's biceps brachii, triceps brachii, and this muscle called the brachialis. Yeah. where do you think the majority of size actually comes from on your arm? You got the biceps brachii, triceps brachii, and the brachialis. You know, guys are always in the gym, 20-inch arms, that's what they're working for. Yes, Miss Routson. Madam, you are muted.
My bad. I think it's the brachialis that kind of bumps up the biceps brachii
Yeah, you're right.
and makes it look bigger.
Yeah, she's right. So the majority, by the way, you're right. You're right. The majority of the size of your arm comes from the triceps. But don't worry, I'm getting to what you said because you were right. Hold on, she's right. The back side of my arm, it's all triceps, and the majority of the size of your arm, period, from all three of those muscles comes from the triceps. So you want to be doing stuff like tricep extensions if you're really trying to put size on your arm. Okay, Miss Lovitz? So focus, okay? I'm not going to get to 20 with this attitude. But Miss Routson's right. The next biggest muscle is the brachialis. And most people don't even know it exists. It's underneath the tricep, underneath the bicep. We're about to get to it. Underneath the bicep. And all it does is flexions. It doesn't go across your shoulder or whatever. And it is actually a thing, as Miss Routson said, that bumps up your bicep. When you think you're looking at my bicep, yes, that's my bicep on top, but actually what's giving it volume is the brachialis underneath. So that's the second biggest muscle. Yeah. Yeah. So that's always fun too. You go in the gym, you get next to some big sweaty guy there, and you'd be like, oh, you're working out your brachialis. And he'll be like, no, I'm working my biceps. Because that's how they talk. And no, I hope you're working your brachialis, because that's actually where your size is going to come from. And actually, they're working both. You can't separate them. You cannot do a flexion of the elbow without working your brachialis, and you're probably always working your biceps too. Cool. Cool. All right. By the way, that bicipital tendon on the long head runs through a groove here between these two tubercles. Anybody know what this groove is called? On here? Okay, one person. Anybody want to tell me what this groove is called? No? Anybody want to gesture? Give me an interpretive dance? Send me a letter? Anybody? Hint at it? Wink in Morse code? Quit eating and maybe just answer the question. Anybody?
The bicipital groove.
Yeah, it's one of the names. Sorry, Ms. McDowell, you're the only one nodding your head, so I knew you knew, so I was like, just, come on, just finish.
You always give me on one bite of celery.
It is called the bicipital groove, because the bicipital tendon actually goes through there, and your tendon can pop out of there, and somebody has to pop it back in. Bicipital groove are, hold on. Intertrabecular groove. Sorry, I just drew a blank there. Intertrabecular groove. Inter means between, the groove between the tubercles. Your latissimus dorsi inserts in here too. We'll get to that later, but it inserts in here. And the bicipital tendon runs right over it and runs up into your shoulder. So there's a lot of stuff going on up in here. Just wanted to kind of point that out. Cool. Moving right along. Here is a picture of the brachialis. The brachialis may not be in this chapter of your book because most people put it down into the forearms. I put it here because we're talking about this region and I want you to know what's under. Like when you hit your arm like this, that's biceps brachii, and underneath it, if I squeeze around it and get underneath, that's brachialis. And so I want you to see what's there. But the brachialis only goes across one joint, only does one action. It creates elbow flexions all day long. That's all it does, and it's good at it. It's powerful. Powerful. Actually inserts into the ulna. Just sits there and cranks out those curls all day long. That's your brachialis. Again, I don't think it's in this chapter of your book. I want to warn you, it's probably down by where your forearms are, but I thought it was appropriate to put it here. Cool. It is palpatable underneath the biceps. It is very reachable. I really advise you to play with your own arms and kind of move your arm around and feel stuff moving underneath your hand because all this stuff is very accessible in there. And there's a lot of cool moves you can do from pinning and stretching in here. Play with arms and legs a lot, everybody, because almost all massage therapists stink at working on arms and legs. Everybody can do a back rub. Everybody. You can't go to massage school and not learn to rub a back, but everybody stinks at legs and arms. I've literally done, I'm not exaggerating, like probably 500 practicals. That means I've had 500 different therapists over the years work on me to get a job somewhere, and I can usually tell in the first couple of minutes whether they're good or not, but definitely where they fall apart is once they get off my back. Because backs are easy, they're flat, they're all nice, you're doing this stuff, you think you're so cool, boom, boom, and all of a sudden you get to a weird arm and a leg and all that kind of stuff, and people just, that's where you really can tell if they're good or not. Okay, triceps brachii. You can only, there are 3 heads. What does tri mean? What does seps mean? Thank you. Your head, thank you. Triceps brachii is the 3-headed muscle on your arm. However, you don't ever see the medial head. You see the lateral head and the long head. When you see those beautiful like horse-shaped, I don't think I've got it, but I don't. But that is my lateral head right there trying to sneak out. You get a beautiful, be quiet, Miss McDowell. You get a beautiful horseshoe-shaped muscle here on a person with muscles. And this is the lateral head, and this is the long head back here. You can't see the medial head because it's underneath them. You'll never see it. You can feel it, but it looks like a 2-headed muscle in pictures, just to let you know. But what's fascinating about this muscle is its main job is to extend my elbow, to pull down from here and extend my elbow. That's its main job. But the long head reaches across and grabs onto the scapula, just like the long head of the biceps. Right? And so the long head, just like the biceps could do a flexion of the glenohumeral joint, a flexion of the shoulder, the long head of the triceps can do an extension. It can actually pull the arm back. So, Ms. Lobitz, do you ever do, I'm sorry to keep picking on you, but you mentioned personal training. It ties into this discussion today, and I like picking on you. Do you ever do tricep presses or French presses or above the head presses or anything for your triceps?
Yes, I've done the pull downs and skull crushers.
Yeah, skull crushers, like this, right? Boom. Skull crushers are where you're laying on your back like this, or you're behind yourself like that.
Both. I've done them both ways.
So I bring all this up with Ms. Lobitz because there's actually a reason that you might want to do your tricep exercises above your head. So remember, a muscle has to build tension in it for it to grow and for it to contract and all that kind of stuff. And believe it or not, when I have a cable pull down or something like that, and I'm here doing those push downs with the cable, you know, you see people doing, they're like, they're only working 2 heads of their tricep. They're not working the long head. The long head doesn't have enough stretch in it in that position to really get worked. It's one of the reasons you'll see guys do the skull crushers or the things above their head where they've got something here, because what's happened here is my long head goes across to my scapula and it is stretched now. And because it is stretched, my long head, my medial head, and my lateral head are all getting a workout here, much better than when I'm down here, and I'm really only working really the medial and lateral head. I'm not really getting the long head very well. So doing them above your head is, you get more tricep going. Yeah. Ms. McDowell, you had your hand raised.
Yeah, I had kind of a question from earlier.
Please.
I wrote down, what did I write down? The insertion for the biceps brachii, and it said like the aponeurosis of the biceps brachii. I don't know what that word means, but I wrote it down anyway. What does that mean?
Well, a good teacher would have told you. So, I showed you the thing with saran wrap, right? No? Maybe not.
Is it like Fascia, is that?
It is fascia. Aponeuroses is sheet-like tendon. That's the quick answer. And so what's really interesting about bicipital aponeuroses is most muscles insert directly into something. So, you know, your biceps insert into the tuberosity of the radius here, which is a bump on your radius. That makes sense. But this bicipital aponeuroses is literally fascia. It's flat sheet-like tendon that is actually woven into my forearm. And so it's a very interesting muscle because it's actually just weaving itself into all the other fascia in my forearm. It's not grabbing onto one spot on a muscle. And that's called the bicipital aponeuroses. But it is sheet-like tendon. And it just kind of spreads out, and yeah, I can't, I mean, I can show you with saran wrap what I mean, but the fact is, that's what aponeuroses is. So, tendons are rope-like fascia, ligaments are rope-like fascia, aponeuroses is sheet-like fascia, retinaculum, which we haven't really learned about yet, but it's ribbon-like fascia that's wrapped around your wrists and ankles. So it's just a way of weaving that muscle into your arm so that it grabs onto everything down here. Yeah. But it's really knitted, it's knitted into your forearm. It's a good way of putting it. If you knit. Yeah. Did that help at all?
Yeah.
I mean,
I remember you doing the saran wrap thing.
Yeah, it's a tricky one. But anyway, yes, it is knitted down in there. Very good question. Okay. So let's talk about where the triceps insert. All three heads come down and insert in my elbow. They insert into the olecranon process of the ulna, but that's your elbow. And the olecranon process of your ulna is, here's your skeleton, here's the ulna, and it's just this back part here, your elbow, really is your elbow. All three heads grab onto this elbow so they can grab it and pull it out and create an extension. But that's the olecranon process of your elbow. So your triceps really do come down here and triangulate and really do insert right here. And when they pull really hard, they can cause an extension. They have to pull really hard, but they do. That's what they do. They all insert into the olecranon process. So your olecranon process is your elbow. Yeah? Okay. I'm going to go over some other language here because it'll help you in just kind of deciphering what your book talks about. So we know the insertion for the triceps. We know that all the heads come down to the elbow, to the olecranon process, and when they pull on that, believe it or not, when they pull on this, I get an extension. That's me extending from them pulling on this. But let's talk about where their origins are, where they glue on to your humerus. The long head has an origin of the infraglenoid tubercle of the scapula. Right here in your armpit, way under here, boom, boom, boom. Way down here, attaches right down there. That's easy to make sense of, right? But the lateral and the medial heads attach to different places. They both attach to the posterior side of your humerus. What does posterior mean? Yeah, backside, thank you. They both attach to the backside of your humerus, but the lateral head attaches to the proximal one half. The medial head attaches to the distal half of the posterior humerus. What does that mean? What's proximal and distal halves of my humerus mean? Anybody? Take a guess. You got nothing to lose.
Sorry.
Go
Somebody
ahead.
raise their hand.
Well, they did, but you turned on your thing. Go for it. Tell me. What do you got?
Proximal is closer to the core of the body.
Yeah. So if you divided this thing if you took a humerus, and believe it or not, it's hard to explain, but this would actually be the backside of the humerus. Let's just stick with that. Backside of the humerus, right? If we cut it in half, what's this half right here? Yeah. And what's this half down here? Yeah. Miss. Thank you. Yes, I'm getting very good at lip reading. Miss Rodson, is that what you were going to say?
I got lost. I had to look at the picture again.
That's okay.
Yeah.
So when we say I just want you guys to learn how to read the book because it's very confusing, but once you get good at it, it's super easy. So when the book says something attaches to the posterior proximal half of the humerus, posterior should tell you go to the back of the arm. Go to the back of the arm. Proximal half means the half that is closer to the core of the body. It's the upper arm. Distal half is further apart. So my horseshoe, this is my lateral head, attaches up higher on the proximal one half. My medial head you can't see, but it makes the thickness down here because it's attached underneath everything on the posterior distal one half. And then the long head doesn't even attach there. It goes over to the scapula. But I want you to understand how to use the words distal and proximal. So when they say posterior proximal half, they mean backside, cut the humerus in half, give me the half that's closer, proximal. Posterior distal half, backside, cut it in half, give me the part that's farther away, more distant. Yeah? Yes. Okay. Cool. Because my humerus has an anterior side, a medial side, a lateral side, a posterior side, a proximal end, and a distal end. Yeah? Yes. Yes, yes, yes. Do I believe that you all understand what I just said, though? Okay, good. Let's find out. Miss Suriel.
Yes.
All right, Miss Suriel. This is a skeleton in anatomical position, so it's everything's normal. What side of the humerus is this?
That is the frontal.
It is the front side. What's the word for front?
The posterior is the back, is the anterior.
Good job. Good way to bring up your brain. Yeah, I like it. Posterior, anterior. I love that. What's this side?
The lateral side.
Yeah, what's this side?
The lateral side too?
On the inside.
Oh, on the inside?
Yeah. Lateral's on the outside. What's on the inside?
Interior?
I like that. How about medial?
Oh, medial.
Yeah.
I thought
No,
Oh,
please say
I'm
it.
confused here because you're talking about this part, because if you lift your arm, this will be to me lateral. Maybe I'm wrong, and that's what I saw you point.
I'm sorry. I'm rubbing the bone. I'm saying this part.
Oh, okay, okay.
I apologize. Yeah, and that's medial. And by the way, everybody, medial is not middle. Not what it means. We'll use the word middle in anatomy, but medial means closer to the midline. So this is the side of the humerus that is closer to the midline. This is the side of the humerus that's lateral, further from the midline. This is the anterior and this is the posterior. Does that make sense, Ms. Suriel?
Yes.
Cool. Thank you, ma'am. Miss Hawks. Hi.
Hi.
Hey, Miss Hawks. I've got two ends of this bone, and I would like to be able to talk about them. What do I call this end that's closer to the body?
That one's proximal.
It is proximal. Thank you. So what do I call this end down here?
Distal.
Yeah. Thank you. Thank you. You've made my point. I'm very happy. Moving right along. Okay. And I think this is the last muscle we did, which was your coracobrachialis. And somebody, and I'm sorry I forgot who because I giggled when I said it, but somebody said, hey, like this is a great name because it tells you where the muscle is, basically. And they were right. Yes. Now I remember who it is. But it goes from the coracoid process to the brachial region. Coracoid process to the brachial region, right? So we know the coracoid process. It's this little scapula thing here, right? Yeah? And it says it inserts into the medial surface of the mid-humeral shaft. That's so confusing. Well, let's break it down a little bit, okay? Miss Walker, why? Miss Walker, why? Which side of the humerus am I stroking right now?
Medial.
Yes, she's 100% right, everybody. So this is the medial surface. That's what they're talking about. And what's the midpoint along here? Right in the middle of the shaft. That's all they're saying. They're saying the coracobrachialis inserts into the medial mid shaft of the humerus. It goes into the middle side. So on my arm, it's the inside right here. It's this medial part, right about there, roughly, mid shaft. And it goes to my coracoid process. It goes like this. And that's why this muscle, we can see some of the stuff it does. If it shortens, we get a flexion or an adduction. Yeah. You know what I think is kind of weird here? Why didn't they put horizontal adduction? I don't think there's an answer to that question. I think they should have, by the way. I think this muscle horizontally adducts. I think the book has a mistake there. I think they left it out. It should say horizontal adduction to me. Because this muscle gets stretched out here. It's going from the coracoid process to my mid-humeral shaft on the medial side, and it could help pull my arm over in an adduction, horizontal adduction. It does have adduct there, but they mean this kind of adduction, which it would do too. Yeah. I point that out because the book doesn't always know. It's better just to kind of figure out your actions because they can get very nitpicky. And that's the coracobrachialis. Muscle that very few people know about. It makes up part of your anterior axillary region, which is a fancy way of saying it. It makes up part of your front armpit. And you can find it if you work on it, somebody. It's not something I often go looking for, but you can. All right, let's see. We're going to review all this really quickly, but this is a great picture of the axillary region. This is why we don't poke directly into the axillary region. But it doesn't mean that you can't work vigorously around all this stuff. But right in the axillary region, right in the dead center, is where the nerves are and the arteries and the veins. But this is a good cross-section to kind of show you all the other stuff that's around it. Please don't be cautious, though. I want you to get into PecMaj. I want you to get into latissimus dorsi, teres major, teres minor, all this stuff in here. Just don't poke directly in there. Do it to yourself with your finger for a minute, and you'll see why you would never do that. There's no meat here. I'm talking about, but feel free to get the borders of the axillary region. You can go to town on those. I mean, to town on them. Please. All I'm talking about is literally right in the armpit, like right in there, dead center. And you can touch there, it's just going to hurt. Like, don't go digging in there. Okay? But not the walls. Hit those walls hard. They're really important. Okay. Good. Stop sharing that. All right. So, we learned about the pectoralis major, triceps brachii, biceps brachii, brachialis, and coracobrachialis. Oh, that's a lot. Yeah. Cool. Okay. Let's do some quick review just to make sure that we retain some of this, okay? All right. Miss Jung. Hi.
Hi.
I know she's like, don't call me. Miss Jung, what muscle am I making the sign for here? What muscle is this?
My muscle.
This, yeah, this is my sign for it. It's a tiny little muscle. Yes. Do you know what this is called?
Right?
Did you just disappear on me? Oh. This muscle right here. What's this called?
Teres major.
No.
Teres major.
Teres major is good, but teres major is back here.
Yeah.
This muscle here.
呀，这叫啥来着？
So it's not the big one, it's the little one. There's a little
前
muscle.
胸的这个啥个肌肉我忘了。
It's a minor. Something minor.
minor。
Yeah. What minor?
它是 minor。
No, no, no. Not teres.
这个肌肉叫啥？我想不起来了呢。
So, Miss
Sorry.
Jung, no, don't be sorry. It's okay. Pectoralis minor.
拍是
Yeah, sorry. Pec,
拍
tor,
托儿
al,
啊
is.
yes。
Pectoralis.
拍个托儿，然后是个
You're doing great. It's hard. It's hard. Pectoralis minor.
拍托哪一阵？
That's good. Now, this hand is pectoralis major.
它是 major。
Yes, so hold on. So take your hand. Do this with me. Let me see your hand. Show me your hand.
只是这老记不住
Put
这
your hand
个。
here. Give
它
me your hand.
是
Miss Jung,
yeah
show me your fingers.
yeah
Put your fingers here.
yeah。
Good. Say pectoralis.
拍托儿绕是
That was good, actually. Pectoralis minor.
拍托儿腰是 major
Minor. Minor.
major
Minor.
minor。
Yes, good. Now, big hand. Big hand. Pectoralis
拍托儿然后是
major.
major。
Good. Good. Thank you. I'll come back and ask you that 400 more times, just for all of you to know. I remember what you don't remember.
Exactly.
That's good. That was good. We're good. Cool.
Exactly.
All right. Miss Walker, why?
Hello.
Hello, Miss Walker, why? Miss Walker, why? What muscle am I signifying here?
Pectoralis minor.
Yeah. What muscle am I signifying here?
Pectoralis major.
Yes. Which one moves the scapula?
The minor.
Yes. How did you know that? What made you so brilliant?
It's one of the shoulder girdle.
All right, I like that answer too. And what is it attached to up here? It hooks to the ribs, but what's it hooking to up here?
The coracoid?
Yeah, it's one of the muscles that hooks on the coracoid process. You were absolutely right. I love your answer too. You knew that it was one of the 5 muscles that moves the scapula around. We'll take it. What does the pectoralis major move?
Which bone?
Yeah, we'll take that.
Bicep? I don't know actually.
Bicep's not a bone.
Oh, the humerus?
Yeah, it actually goes over. Remember the silly tape I had on? It goes over and grabs on here. So we say it moves the glenohumeral joint because that's the joint that changes, but it's moving the humerus. You're absolutely right. It's moving the humerus. Cool. All right, let's review for everybody because I'll probably ask this question to a lot of people, right? So what's this muscle?
Pec minor.
Yep. What's this muscle?
Pectoralis major.
Yes. Which one moves the scapula?
Pec minor.
Yes. Which one moves the glenohumeral joint and the humerus?
Pec major.
Yes. Which one is more superficial?
Pec minor?
No, pec major. Pec major is on top, pec minor is hiding underneath.
Okay, yeah.
Cool. Thank you, ma'am. Thank you. Hey, Miss Walker T. Walker T. Where you be? Walker T. Miss Walker? Going once?
Yes,
Oh!
I'm here. Walker T's here. I'm here.
Oh, Miss Walker. Yeah. Miss Walker,
Oh, this is almost a terrible day for me, Mr. Tasco.
you're doing great. You're making me smile too, and that's worth a lot right there. Your stress is making me happy. Yeah.
Okay.
Yeah. That's not reverse psychology, that's inverse psychology. You feel worse, so I feel better. Miss Walker T, Ms. Walker T, first of all, what muscle am I signifying here?
Pec minor.
Yeah, pec minor inserts into what ribs?
Third, fourth, and fifth.
Third, fourth, fifth, yes. And its origin is what?
Coracoid process.
Yes. Therefore, it can depress, protract, or abduct the scapula. Yes. What muscle is this?
Pec major.
Pec major.
That's the major one.
Yeah. What's? Can you? You don't even have to be exact, but can you tell me its origin and insertion a little bit?
Okay, origin is the third medial part of the clavicle, and then it goes
Half, but that's cool. We'll take it. Half medial part of the clavicle.
half.
Yeah, I know what you're thinking of. I know what you're thinking of.
Scott, just give me something here.
Yeah, you're doing great. You're doing great. No pressure.
Half medial part of the clavicle, and then it goes down the sternum, the first through sixth ribs.
Yeah, that was great.
Did I get it?
Yeah, and then it crisscrosses applesauces over here, and it attaches to what?
The humerus.
The humerus, yes. The crest of the greater tubercle.
The crest of the greater tubercle. Okay.
Yeah.
I mean, I was going to say that, but you just threw it out there. So
it's a really big, powerful muscle, so it needs to grab on something big and powerful, and it needs a crest. So crest of the greater tubercle. Sorry. Awesome. Good job, Miss Walker. Good job. Your day is almost over. Hang in there. Cool.
Okay.
Miss Vincent. Hello. Miss Vincent, we discussed 3 muscles today that essentially make up my arm, my brachial region. Like, I know I got delts up here and things like that, but I'm talking about this meat right here. 3 muscles that make that up. Do you remember any or all of those 3 muscles?
The biceps brachii, the triceps brachii, and one that's difficult to say, the core.
No. That's legit too, by the way, but I was thinking brachialis, the one that's underneath.
Brachialis.
Yeah, but you were going to say coracobrachialis, which is in the right ballpark. Yes. My question might not have been good. That was good. So, what muscle am I touching right now then?
Biceps. It could be. Okay, biceps brachii.
Yeah. If I dug underneath that, what muscle would I be hitting?
Brachialis.
Yes. If I went to the back side, what am I grabbing here?
Triceps brachii.
Yeah. Good job. Thank you. That was fantastic. Ms. Routson. Hi.
Yes, sir.
Yes, ma'am. All right. Miss Routson. What do I want to ask you? Miss Routson, so Miss Vincent was kind enough as to tell us the 3 muscles that made up kind of the brachial region of the arm, kind of. What were those 3 muscles again, Miss Routson?
The biceps brachii, triceps brachii, and the brachialis.
Yes. Which ones can be found on the anterior side of the arm?
Biceps brachii. I'm kind of curious about the brachialis because I know it's like right here.
Is that part of your answer too?
That's what I'm wondering.
It's anterior.
Technically, okay.
I just wanted.
And doesn't it?
Yeah, go ahead.
Come up like. Let me use your foot, honey.
It's actually right. It's right here.
Okay.
Yeah, but it's anterior still. So I'm just trying to get like people thinking in certain ways. Which of those muscles or all of them are posterior?
The triceps brachii is posterior.
Cool, thank you. Of those 3 muscles, this gets trickier, but it's the way I want everybody to be thinking. Of those 3 muscles, which one crosses over 2 joints?
I want to say the biceps brachii.
Yes, you are correct. But it was kind of a trick question. Do you want to add to it at all?
Trick question me. No, Mr. Scott, please.
So biceps and triceps brachii, everybody, cross over 2 joints. all these things, the brachialis, the triceps brachii, the biceps brachii, move my elbow. They're all great at that, one way or the other. But the long head, remember, of the biceps brachii goes up here and crosses over the joint. Remember, the long head of the triceps brachii crosses over to the scapula. In fact, the long head of the biceps brachii goes to the supraglenoid tubercle. The long head of the triceps brachii goes to the infraglenoid tubercle. And the only reason I'm making such a big deal out of that is it means they can affect shoulder action. That's not their job, but they can mess with your shoulder. And this stuff will become important later when somebody comes into you guys and they say, hey, my shoulder's bothering you, and you're like, I don't know what's wrong with it, but we probably should loosen it up, it just seems tight. Well, that's Massage 101 that most therapists actually don't know how to do, but and what you do is you loosen up every muscle that crosses over that joint. So most massage therapists are like, well, deltoids, sure, great, thanks for remembering the deltoids, but they forget the triceps and the biceps. And the CoracoB brachialis and all that kind of stuff. Good job, Ms. Routson. Thank you. Thank you. So I'm just pointing out that this stuff will come in handy a lot later. And you will feel very like, wow, I've got stuff to work with here. I love that. Okay, let's do some homework. Yeah? Get that out of the way with? All right, let's see. You've got two things. You've got to test on these muscles. And you've got a chapter questions for chapter 20, which is the muscular system in your other book. Hey, by the way, this is not a criticism too, this is just helpful advice. Obviously you can metagame the tests. Obviously you can Google most of the answers and all that kind of stuff and kind of get your way through them. And that's fine, I'll never know, don't worry. And I don't have a judgment about it, but I will tell you later on, it's super duper helpful if you know your origins and insertions for all the muscles, because later when you have to identify them and find them, it is pretty much impossible if you don't know your origins and insertions. So when in doubt, try to work on that, because it'll really, really help you, and it will be coming back up over and over again. And that is the stuff, the end of the year test, we really do look at, that kind of stuff. Let's see. Let's give you guys, boom. Okay, so you should see two things. Number 20 test on the trail guide, shoulder and arm, PecMaj, bis, tris, brachialis. And you should see 21 matching for massage therapy, chapter 20 on the muscular system.